Our MSc Nutrition and Dietetics course really focuses on practical learning and getting the students to apply their knowledge learned in the classroom. So in the first year of the MSc Nutrition and Dietetics course, we get the students into our state-of-the-art simulation suites where they get the chance to practice working through patient cases, looking through medical notes, looking through bed end notes, gathering information from all of these resources, practicing doing a patient consultation, sometimes with a real service user, and drawing all the theoretical knowledge they've gained from the seminars together and applying that to a real patient case in a simulated hospital environment.
So the whole programme is geared around getting them ready to go on placement, getting them ready to be healthcare professionals in any part of the sector that dietitians work on, be that the NHS, in industry, or with sports athletes, or with young children. So the lectures and the seminars and the practical sessions are geared around those professional core values. So we deliver lectures so they have the theory, and then we very quickly make sure that they put that into practice. We do a lot of group work, we do a lot of role play, we do a lot of simulated sessions that are there to simulate what they will do in their role as healthcare professionals and what they will do while they're on placement.
So we've learnt about clinical medicine and pharmacology, nutrition and food science, and behavioural aspects of food and nutrition. I found the pharmacological side really interesting, learning about what drugs are used in the hospital settings, and the sociology side, so understanding the wider context of dietetics.
I found all of the modules really interesting, specifically the clinical medicine and pharmacology. And so working as a dietetic assistant, that's filled in a lot of the gaps of my knowledge and has given me more understanding of nutrition and dietetics.
So one of the facilities that our students have access to on the MSc Nutrition and Dietetics course is our state-of-the-art food skills lab. Students get the chance to practice adapting and modifying diets in line with dietary recommendations for certain clinical conditions, and they get the chance to experience what these adaptations will do in terms of the taste and texture and appearance of the food. So they get the chance to experience what their patients would experience if their patients were having to follow these dietary recommendations, and that really helps our students to become very patient-centred practitioners.
I think it's great. Everything's quite new and modern. You've got everything you could want and need. The library's great and there's always space. There's really good kind of food and drink facilities and places to do wider learning as well, and it never feels crowded or too busy.
So when our postgraduate nutrition and dietetics students arrive on the programme, they're allocated with a personal academic tutor, which is me, and I'm also their programme lead. I'm the personal academic tutor throughout the programme, and I'm also the module lead for them when they go on their first and third placement, so they really get that continuity in terms of who they go to for help at the beginning of the programme and at the end of the programme and throughout the programme, because I teach on a lot of the modules that they're taught throughout it as well. And they're postgraduate students, so they may feel like they don't need that pastoral care because they've been students before, they understand how universities work and they understand the needs of an academic student. But it's really important because they're healthcare professionals now and they need to take responsibility for their own health and well-being in order to make sure that they are health professionals that can do their role in the future and care for others. So we think it's really important here at the University of Chester that we mentor them and teach them and guide them in making sure that they prioritise their own health and well-being, and that's what they use their personal academic tutors for.
They've been really helpful. You can tell that they really want the best for you and they want you to do well in your course. And in the induction week they also signpost you to the other services available at Chester, so academic skills and the library services, which have been really, really helpful.
So following on from my postgraduate degree, I'm looking to get into clinical dietetics, specifically surgery. So the course has really helped me to find that path and give me the clinical skills as well as the background knowledge of how to get into the career.
So from day one on the programme, we are getting these students ready to join the workforce, whether that is in the NHS or whether it's in industry, whether it's in sports athletes or in research and innovation. They are taught by lecturers who have just come from clinical practice or are in clinical practice, so they can ask questions about what their role is going to be in the future. They're exposed to people that they are going to work with in the future and to potential employers. We showcase our students to make sure that they are known across the Northwest to potential recruiters. These students are being interviewed for jobs way before they've even finished the programme, and their success rate is very high.
So I'd like to be a clinical dietitian working within a hospital setting. I feel like the practice placements have prepared me well, and when I go on placement itself, I'll understand better which avenue I'd like to go down within the hospital setting.